Hello, it's November 4th. I haven't posted any videos till today for about 5 months. So I'm just going to explain a little bit of what's been going on, why I haven't, and a little bit of a catch up. Um, Initially things had just gotten busy and life was happening. So it's not my focus to make videos. I enjoy doing it. Here on my face, but it's just not a priority in my life all the time. So that was like back in May. Then July happens. July 12th, Alora had a brain MRI. It was something that was initially going to be done November of 2021 when she was already going through a procedure. However, they could not book the MRI at any point in November. So it was not the most important thing. It was being done because she was already going to be sedated. So she had an upper and lower scope in November. Biopsies were taken. And all of this is to figure out why she isn't growing. She has struggled her whole life to gain weight, to keep the weight. Anytime something happens, illness or surgery, whatever, she loses weight and it takes months and months and months to gain it back. So we literally fight for every single ounce. She has turned three weeks ago, and she's 18 pounds. That's not normal. She's relatively healthy, but it's a huge concern. So back in November of 2021, we went ahead with the upper and lower scope with her GI doctor. The reason that he wanted to add on the brain MRI and also abdominal MRI too was he was looking for a growth on the hypothalamus. It is called diencephalic syndrome, but it's quite rare. So we went ahead. Well, there really wasn't any significant findings on her scopes, so life goes on. We see Dr. Bradford in May again, and we have to track her weight very closely, all of her growth. She's followed by, I think, 5 specialties, and every time she's weighed, even though she's, so old now, she has to be stripped down naked because we have to track it so closely. So sometimes I have to deal with the nurses giving me guff. If we use paper diapers, that's fine for her to get weighed with a diaper on. Because, we weighed, it's like a quarter, it's just a fraction of an ounce. So sometimes I have to deal with people that don't know her, don't know the situation, and think they know better than me, that want to give me a little bit of grief for stripping her down. Oh no, we don't need to do that. Anyway, so I've been instructed by multiple specialties to do that because she's being tracked so closely. So May, we see her GI doctor, review everything, and he says, okay, let's go ahead with the brain and abdominal MRI. So, yay. He wanted it done no later than the end of June. This is middle of May. So, again, couldn't book the MRI. Finally got it on July 12th. So this is a sedated MRI, so she has to be put under general anesthesia. It's a whole thing, because they need a pediatric anesthesiologist and the MRI. And so we did that. And I really need to sit down and count, like, how many surgeries, how many procedures, how many sedations she's had. You know, like she's been sedated for rectal biopsies before. You know, like that's like a procedure. It's not an all-out surgery, but it's another sedation too. And being that she's just turned 3, you know, like it's overwhelming. I need to sit down and, you know, count it up again. So July 12th comes and we do that. My point is that this was not something that concerned me. Wasn't something that, you know, the process of everything and helping her through the post anesthesia and everything. Yeah, that's stressful, but I wasn't concerned about the actual results. There were not significant findings in the abdomen. Great. July 13th, I get a call from her GI doctor. It was 11:30 in the morning, and he was rather frantic. And he starts explaining to me that he's already talked to the neurosurgeon. How is she doing? She has to be admitted. Like, okay, we can wait till tomorrow, but she's has to have brain surgery on Friday, the 15th of July. And he tells me everything, and I said, hydrocephalus is not new to me. We saw this since the pregnancy. We saw this on NICU head ultrasounds. And I've been told repeatedly it's not a concern. It was something that I never thought about with her. I mean, she's had a lot going on. 3 years ago, right now, she was 4 days post-op from her first surgery. And at that time, I thought we were one and done. Nope, we're still in the thick of it. And I really don't think people understand the magnitude of the stress that I'm under constantly. It's just a lot, just managing and coordinating her care and her therapy and all of her appointments, and even booking 6 months out appointments this week to March. Of course, I couldn't get her sleep study because the sleep studies that she's supposed to have done now are being booked out to March. Of course, I couldn't get that, and her next Down syndrome clinic visit on the same day. It's really frustrating. So, yes, Alora's stable. I tell her doctor on the phone. She's normal to me. You know, she's playing, she's happy. She goes through ruts where she's sleeping excessively, where she's not herself completely. She doesn't have words. She doesn't talk. She can't tell me. So I just think, well, she's had this her whole life. Why is this crisis now? You know? So then, a couple hours later, I get a call from neurosurgery. Yay, another specialty. I'm excited. My whole day just went so there's a great deal of concern about her, and I'm just looking at her. She's just started taking steps, just starting to walk in July. At 2 years, 9 months, 1 day, she took her first steps to me. She carried the little Little Blue Truck Halloween, and she walked to me with it. And I'm just looking at her in all of her innocence, and And now I'm being forced to put her through more. We're just having a quiet day at home today, on that Tuesday, July 13th, to help her recuperate from the previous day. So it was a very long, exhausting afternoon, not spent cuddling up with my toddler, not spent nurturing her, not spent giving her a calm, relaxing day, which she desperately needs after being out and going through these things. I was on the phone a lot, and then I had to call friends and my sister to let them know. And I can't even process it. And I have to help them understand what's going on, the significance of it, the timetable. It's like, they want her hospitalized. They said, well, if she's stable, we can wait till the next day. If not, she needs to come directly to the ER, which is what ended up happening. So, my oldest had plans for a movie night with a friend that lives out of state, and I really didn't want to spoil that for her. She's a young adult, and so I had to tell everyone, this is what's happening. Do not tell Emily. I want her to just be able to, go to work, go to her plans, and I'll talk to her tonight. So everyone was on board with that and respected that. Things changed with Laura that night, and neurosurgery says she needs to come in now. So now it's about 6:30 p.m. and I have to pack, and push myself to take her to the hospital, and knowing what lays ahead. My daughter, my oldest, being the wonderful, rule-abiding young lady she is, she had her phone on silent. Although I tried to message her, I tried to call her. It was right before the movie was going to be beginning, and so I had to call the theater and ask for them to have her call home, and that happened really fast. The theater's only a few blocks away, so I had to ask her to come home right away, and I had some news to share with her. I'm going to I intended to make this in one video, but I have to plug my phone in, so I'll be right back. All right, so I couldn't even really wrap my brain around everything that was going on and the urgency of everything. And I've had to, tell several people about it. And now I've got to try to manage my emotions yet again and tell my oldest what's going on. So that was a difficult night. My good friend Sarah came over She has a child that has now an adult too, has been through probably dozens of surgeries. So she's very well acquainted with the process, the stress, yada yada. So she came and she was going to come along and take us to the hospital. So I had to get busy packing. We left at about 8 p.m. They knew that we were coming. The thought was that, the expectation that we were told was that they would have a room for her. Yeah. We waited hours and hours in the ER. We explained everything going in. And there was a lady, the ER at this hospital is for both adult and pediatric patients, which are two adjoined but separate hospitals. They're adjoined with a skywalk. So, there was a lady, there's a closed off pediatric waiting room that you need access. You can only access if somebody lets you in. The nurses push the button, or security guard push a button. That's the only way you gain access. There was a lady in there, just I wouldn't stay in there with my daughter. She was yelling and swearing, and she had like an older teenage daughter, and she was I called for security, and I left the room, and I said, I'm not staying in there with her. She was trying to argue with everybody, and like, about what? So, stress upon stress, we're supposed to be taken to a room. So it takes hours just to, it was ridiculous. So they had to basically, after about, 3 hours, I think, had to admit her to the ER just to get her whatever. Like, do whatever you need to do. Get us out of here, right? So I think it was 12 or 1 in the morning when we got her room. And my friend Sarah this was supposed to be kind of like a down and back thing for her. And she's exhausted. I think she didn't get home till between around 2 something. So they had wanted her admitted in advance of her surgery on Friday to get her all prepped and everything, get her optimized for surgery, they said. So, yeah, that was the thing. I'm like, well, we've been through surgeries, so why does she have to be admitted days ahead? It was a long process. I got to sleep a few hours. Laura was exhausted. And I am going to try to go back in time and upload some of those videos and stuff. So, Friday came, and, I had stupid questions like, well, how much hair is she going to be missing? Like, that's pretty vain, but it's like, okay, I'm just curious what to expect when she's unbandaged, So, really, there's hardly any hair loss. Friday, so we had to stop her feeds, her feeding tube, at midnight, and then she could have like Pedialyte till 4 in the morning. And then I found out that she was just like an add-on. She wasn't scheduled. They were just going to slide her into the OR. It was about an hour and a half procedure for this brain surgery, and just squeeze her in between other cases. So all day long we're waiting, and it hits like 6:30ish at night, and I've asked for her food already, and wasn't until 7 p.m. So I'm like, she's dehydrated. Like, she's not on fluids or anything. She's just had to starve all day, you know? So I just made the decision, like, they didn't bring me her food, so I just mixed up food and fed her. And 12 minutes later, the neurosurgeon walks in. And, oh my gosh, he is such a great guy. He has videos on YouTube I've been listening to this last week while I process this new information. And he said, I'm so sorry, you know, we can't do the surgery today. We had, you know, all these things happen, you know. I mean, I was seeing MedFlight come and go. I don't know which, you know, hospital the patients were going to, but yeah. So I said, that's fine. I just fed her 12 minutes ago because I've been trying to get an answer for a couple hours, and he's like, oh, good. It's like, I said, I guess we both came to the same conclusion. So then the next day was going to be the same thing. So I got some food in her that night. And then, so same routine that night. And, you know, I'm full of anxiety. Like, you don't know what to plan for. And again, on Saturday, she didn't have an OR time. But her doctor, you know, the surgeon had said he's going to try to get her as first case. And, you know, it's very obvious that it's not up to him when the patients go in. So, yeah, she went back first thing Saturday morning. And the post-op was the worst it's ever been. Absolute worst. So there's a lot of things that can affect the post-anesthesia. Age, awareness level, what they use for sedation, you know, surgical pain, yada yada. She had, I've never seen her breathe like this before. And this went on for several hours, I think like 7 hours. And Sarah's with me. And her husband, my pastor Fred, was there. And, you know, like, my sister had came by, like, but, you know, with the COVID protocol, you could only have, you know, certain people, certain number of people and whatnot. It's hard to think back on all of this, honestly. You know, Misty, just great support, and Melanie, and just so, but then it's just Sarah and I in the PICU post-op. Like, it took extra time to send her from the PACU up to the PICU because she wasn't stabilizing, but they kind of ran out of options of what they could do over there. So, I mean, she was stable in the most important terms, but it was weird, and it was very stressful. I do have a very short clip. I think it's about 20 seconds of what her, you know, breathing was like in recovery. I couldn't imagine the amount of exhaustion she would have had from breathing like that. So Sarah and I were walking on eggshells the whole time, and she would like watch us, and like if anything changed, just it would start all over again, and all the progress we made in calming her, trying to get her to sleep, it was all gone. Hours hunched over the crib, you know. Her and I would take turns holding her. Like, there was nothing we could do to help her. Like, it was insane. But she did eventually, stabilize. They gave her a lot of meds to kind of counteract other things and this and that, and they were really quite amazing in the PICU. Once she kind of got out of that situation, there was a really quick turnaround, and we actually discharged after like one day after her surgery. I think it was like 30 hours post-op. We discharged straight from the PICU, and I didn't have any concerns. Normally she would have gone to a general floor, but she was, I've been through this so many times with her, it's like, oh, we're good, go home. Thank you. And a lot of times I do like her to stay extra, but there was no reason. She didn't show any. And I was completely comfortable taking her home. So in the past I have advocated for her staying longer for pain management and this and that, because she does seem to have a lower tolerance for pain from what they tell me she should be feeling and what we're actually seeing, So I'm just going to finish this video, and I'm going to do another one, and we'll try to bring everything up to the present in the next video. Thank you for watching. Goodbye.